Sarcopenia negatively impacts exercise tolerance, quality of life, and prognosis, and is associated with increased exacerbation rates, hospitalization, and mortality. Global studies have reported sarcopenia prevalence in COPD patients ranging from 20 to 40%, with higher rates in advanced disease stages. However, data from India remain limited and heterogeneous despite the country's high COPD burden driven by smoking, biomass fuel exposure, and environmental pollution. For early identification and targeted interventions such as pulmonary rehabilitation and nutritional support. Method and materials. This observational cross-sectional study was done in MMISR Mullana after obtaining approval from Ethical Committee of the institution. 100 patients of COPD were taken from indoor and outdoor wards of the MMISR hospital. All subjects were subject to detailed history and systemic examination for COPD, and severity of COPD was used using Gold's criteria, and sarcopenia was defined as per EWGSOP2 2019 criteria, using skeletal mass using BIA, muscle strength using handheld dynamometer, and gait speed by 6-minute walk test. In inclusion criteria, they were on all diagnosed cases of COPD. In exclusion criteria, patients admitted with pneumonia, septicemia, COPD acute exacerbation with other comorbidities, hypertension, type 2 diabetes, CKD, CLD, and malignancy were eliminated. Methodology. All selected subjects were detailed about their present, past, family, and personal history, especially about smoking, drug intake, and history of falls. Subjects were assessed for severity of COPD by undergoing pulmonary function test (PFT), and all subjects were subjected to EWGSOP2 criteria. Patients were first subjected to gait speed. In gait speed, first we have checked if the speed is more than 0.8 meter per second or less than equal to 0.8 meter per second. For that, in less than 0.8 meter per second, they were subjected to muscle mass. In case if they have low gait speed and low muscle mass, sarcopenia was present. If muscle mass was normal, then there is no sarcopenia. In gait speed, if it is more than 0.8 meter per second, they were subjected to grip strength. If it is normal, then it was no sarcopenia. In case of low grip strength, they were subjected to muscle mass, and again they were subjected to, if they have low muscle mass, they had sarcopenia, otherwise no sarcopenia was present. In my study, severity was divided according to Gold's classification: mild, moderate, severe, and very severe. In mild case, there were no cases of sarcopenia present and 3 patients were present. In moderate case, there were 5 patients with sarcopenia and 9 patients they didn't have sarcopenia, total 14 patients. Combining severe and very severe, there were 26 patients, 31.3%, and 57 patients did not have sarcopenia. Total sarcopenia was present in 31 patients and 69 patients did not have. In case of muscle mass criteria, it was less than 7 kg and more than 7 kg. 67 males were there. Out of that, 27 males had sarcopenia and 40 did not. In female, less than 6 and more than 6. 4 female patients had low muscle mass and 29 had more muscle mass. Gait speed less than equal to 0.8 and more than 0.8. Less than equal to 0.8, there were 32 male and 35 male were in more than 0.8. In female, less than equal to 0.8 were 9 female and more than 0.8 was 24. Grip strength for males, it was less than 27 kgs and more than 27 kgs. So less than 27 kgs there were 30 males and more than 27 kgs there were 37 males. In females, the criteria was less than 16 kgs, where we had 4 females, and in more than 16 kgs we had 29 females. Sarcopenia was present in 31% of COPD patients. Prevalence was significantly higher in males, 40.3% compared to females, 12.2%, and it was statistically significant. Most cases were clustered in the age of 50 to 69 age group. Low muscle mass was observed in 31 patients, reduced grip strength in 34 patients, and impaired gait speed in 41 patients. By Gold grading, sarcopenia prevalence was 0% in mild, 35.7% in moderate grade, and 31% in severe and very severe COPD. The association between COPD severity and sarcopenia was statistically significant. Conclusion: the present study demonstrates the sarcopenia is a significant comorbidity among patients with chronic obstructive pulmonary disease with an overall prevalence of 31%. The burden was disproportionately higher in males compared to females, and sarcopenia was strongly associated with advanced stages of COPD as per Globe classification. Importantly, affected patients exhibited reductions in muscle mass, grip strength, and gait speed, reflecting impairment across all dimensions of sarcopenia as defined by contemporary diagnostic criteria. These findings indicate that sarcopenia is not merely an age-related complication but is closely linked to the severity and systemic nature of COPD. Our observations are consistent with global evidence suggesting that sarcopenia adversely influences pulmonary function, exercise capacity, and quality of life. Mechanistically, systemic inflammation, oxidative stress, hypoxia, corticosteroid exposure, nutritional deficiency, and inactivity like convergence to accelerate muscle dysfunction in COPD. The clinical implications are profound as sarcopenia identifies a high risk subgroup prone to exacerbations, comorbidities such as osteoporosis, and potentially increased mortality. Early recognition through routine assessment of muscle mass, strength, and physical performance is therefore essential. Incorporating pulmonary rehabilitation, nutritional support, and resistance training into comprehensive COPD care may mitigate sarcopenia, improve functional outcomes, and enhance long-term prognosis. Future multicentric longitudinal studies are warranted to further clarify causal pathways and evaluate the impact of targeted intervention. Thank you.